With all the commercials you see on TV about acid reflux, you would think everyone has it. But do they? And is it serious? Dr. Peraza has joined us in the UH Broadcast Center to answer these questions and more. Dr. Peraza is a gastroenterologist with the University Hospital. So welcome back to our show.
Thank you.
Now, we call it acid reflux, and you call it GERD. So what is it really?
So GERD is basically an acronym for gastroesophageal reflux disease. So that's pretty much it.
Okay, so what does that mean? What happens in your gut?
So what it is basically the junction between the esophagus and the stomach is called the GE junction. When the acid kind of comes back into the esophagus and burns the mucosa of the esophagus, that's when we see symptoms of GERD, which are usually heartburn, chest pain, some acid taste in the back of your throat, or some bitter taste, things like that.
Okay. Sometimes food even comes up, you said.
Yeah, they're both.
Boy.
Yeah. Belching, yeah.
Oh, yuck. So does everybody have some kind of form of GERD?
It's normal to have some kind of a GERD because it's not like a tight junction that doesn't allow anything to go back and forth. So once in a while is fine, but if you have something like everyday GERD symptoms, you're taking a lot of medication, and that indicates that you need to be seen by a gastroenterologist.
Is it just the reflux, or is there something else that could cause the same kind of symptoms?
So once there is reflux, the acid can cause damage to your mucosa and then cause what is called erosive esophagitis, and that's what we see in our endoscopy. And sometimes the lining can change if you have prolonged GERD symptoms and what we call Barrett's esophagus.
Okay.
And Barrett's esophagus is the precursor lesion for esophageal adenocarcinoma. So that's why we worry about that.
Much more serious. That's
Right.
a form of cancer. So
Right.
we don't want that. So how do we treat this?
So usually GERD, if you have daily symptoms, something that wakes you up in the middle of the night, that indicates that you need to be on treatment. Most people will try over-the-counter PPIs to begin with. But again, there are certain types. You have to take it before you eat anything in the morning, 30 minutes. And if you're taking more than 2 pills a day, that means you have to see a gastroenterologist, get evaluated for any complications and if something else is going on.
So they just have to go down there with a scope and take a look. Is
Right,
that it?
that's
Okay.
correct.
Any other options with regard to just taking over-the-counter pills?
So usually, once you identify what the cause is, for example, if it's obesity, you have to lose weight. If you're a smoker or you're an alcohol, those kind of things, so you have to take dietary modifications. But if it is an anatomical issue, what we call a hiatal hernia, there are certain surgical options available. And one of the newest ones is the LINX procedure, which is like these magnets that go around your GE junction and allow food to go in, but doesn't allow the reflux aid to come back into the esophagus. So there are some interesting treatments there.
Wow. So magnets, do you attract then safety pins and other things too?
I don't think they're MRI safe, I don't know, but yeah, definitely it won't attract anybody else.
Okay, so we want to keep it from getting serious, and so
Right.
there's things we can do. Good always to know.
That's good to know, yeah.
So in general, GERD can be irritating to you and your esophagus, but with proper treatment, this condition can be managed before becoming more serious. To learn more, use the information that's coming up next. And my thanks to Dr. Peraza for information that was actually very easy to swallow.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE, that's 5433, or log on to www.uhhospitals.org/lifelonghealth.